The lips are a really exciting area to treat, and very often we're just enhancing the red part of the lip. But often patients are worried about the vertical lines that they see in the white part of the lip. Some patients call it barcode lip, or they call them lipstick lines. And these are very troubling for people, and things that start really early on in the 20s and get worse over time. A very common complaint in a cosmetic practice are lip lines in the white part of the lip above the red lip. And these are things that develop starting at around age 20 to 25 and continue to develop through the years. And patients will ask, well, what causes that? The main cause for these lines are repetitive motions: talking, eating, lipstick, drinking from water bottles. So with repetitive motion, that skin is weakened and eventually wrinkles form. In a patient that's chronically sun exposed or someone that smokes, we'll see those lines develop even more rapidly and more deeply. So what do we do about these lip lines? Well, when the creases are deep, we may just use a simple little dermal filler into those creases. But very often that white part of the lip has lost its structure, so we need to develop collagen underneath the surface of the skin to make that skin stronger. And that doesn't mean necessarily making that lip bigger. We're talking about making it stronger. So we may use lasers, we may use RF microneedling devices such as Intensive or Infinity. We may actually use carbon dioxide lasers with and without a topical product called Sculptra. So there are many different types of procedures we do, and that's determined by amount of downtime a patient can tolerate. It's determined by how deep those lines are, and it's determined by, very often, the skin type of the individual. Certain lasers may be safe for one skin type and not for another. So there really isn't one size fits all kind of treatment for these lines, and we talk about different options. Some patients have asked about, well, what's going on now with these PDO threads? Can PDO threads be used for lip lines? And yes, PDO threads are agents that are injected underneath the skin to stimulate collagen. They're things that the body absorbs and are gone in a matter of months, but the collagen synthesis results in improvement of the skin quality and is long-lasting. Another really exciting recent development is the use of a fractional carbon dioxide laser, which is actually a pretty aggressive laser, but we're using it in a gentle way. We're using it at about 20% of the intensity we normally do. And what we're doing is actually using a filler, which is what we call a stimulatory filler, that is used just to stimulate collagen. And we use it topically. And what we find is that laser treatment is opening up channels in the skin whereby that topical agent, which we put on right afterwards, is able to penetrate through the skin to create the changes we want. So this is synergy, where 1 + 1 is 3. So we're able to use a laser, which customarily would have extensive downtime, but because we're using it in a gentle fashion, we're going to see very rapid healing. And again, better results because we're also using at the same time a stimulatory filler. Again, this is not about making the white part of the lip bigger. We don't want to do that. We don't want to change the size of the white part of the lip. It's about making the skin stronger. As with all aspects of cosmetic medicine, we also talk about lifestyle. We talk about avoidance of sun. We talk about stopping smoking. We talk about the use of skincare products on the skin every single night. So those are really important adjunctive things to do in addition to using the technology.